Hello and welcome to Dr. a podcast by HealthOK Global. My name is Kaustubh Morin and I am the Director of Partnerships and Implementation at HealthOK. And Dr. Dialogues is the show where we bring you inspiring journeys of healthcare professionals. I'm host today and we are honored to be speaking with Suchit Dadia, a highly regarded ophthalmologist based in Ahmedabad. Before we begin, quick word about HealthOK Global. HealthOK is not just practice management, it's a doctor first platform designed to power better care. Built by doctors for doctors, it helps save time, streamline clinic operation. Make sure the focus stays where it belongs. Now, let's get to know the incredible journey of Dr. Tadia, Dr. Suchit Dadia. Dr. Suchit, could you start by telling our listeners a little about yourself and what do you do ophthalmology?
First of all, thank you, Kostu, for having me on this platform. My name is Dr. Suchit, and I am an eye specialist, so to speak. But more importantly, I have been someone who has always been fascinated by the power of vision. While growing up, I never had glasses, but I always used to see my colleagues with glasses, and the kind of dependency they had on them always surprised me. Like some of them, even a slight haze on their glass would require immediate cleaning with their tissues, their napkins. And, they always used to tell me that whenever they used to wake up in the morning, the first thing they did was look for their glasses. Otherwise, they can't even see the time on the clock, right? And at the age of 14, 15, that used to be like very surprising to me that how that would work.
Indeed.
And since as far as I can remember, my grandfather always used to hold a handheld magnifier to read the newspaper. He had a habit of reading the newspaper every day and used to use a magnifier to read. And I always had this question, why? What must have happened to his eyesight that just by using simple glasses is not enough? He needs a magnifier. It was years later that I came to know that it is a condition called macular degeneration, which is a permanent, irreversible cause of blindness, which makes a patient use a magnifier to just be able to read small scripts. So, sight is such a fundamental aspect of how we experience the world, our relationships, our work, our memories, and the mere thought of being able to either restore or even improve that for someone always felt incredibly meaningful to me. So yeah, that's what I can say would be, what drew me to ophthalmology even before I ever got into medical school.
Yes. The work that you do, and my son, he's 13 and he has glasses. And that struck me when you said every morning, the first thing he's doing is looking for his glasses. Uh, and that is really important. And I sometimes wonder, had it not been for glasses, it would have been so difficult.
Right. Yeah. Even a power as less as it might sound like -1, minus 2, for that patient it means the world because
Yeah.
without that -2, anything beyond 3 feet is a blur, you know. So somebody who hasn't worn glasses ever would never be able to understand what that person might be going through. So that's how important even a correction of, let's say, a -0.5 might be for some people to give them the accuracy in vision. I think it's one of the best things I can do as an ophthalmologist. You can literally change someone's quality of life just by either giving them a prescription or performing a surgery. Like overnight, their lifestyle, their personality, everything. And I've seen it with my own eyes. It just changes. It just shifts. They get a whole new perspective on life. Yeah. So yeah, that's the impact created by even technically a very small microsurgery. We are practically operating within millimeters. Like the amount of area I have within the eye when I'm operating is in the range of 2 to 3 millimeters, right? Our entire eye is just a 2.5 centimeter long, right? So that's how micro it is. But you can literally change someone's perspective and quality of life overnight. That's the craziest aspect about, I would say, about being an eye surgeon.
You've pursued advanced training, really, Dr. Suchit, MBBS at Ahmedabad, MS in Mumbai, followed by fellowships like the FICO at UK, DNB, and MRCS at Edinburgh. So what inspired you to take on such a rigorous path?
In retrospect, if I think about it, I think what always kept me going in those initial years was a combination of curiosity and somewhere even responsibility. Because as we all know, medicine and especially ophthalmology is evolving so quickly that stopping at the very basics is just not enough. Each step that I took was about broadening my perspective and, deepening my skill set. Technically, we can say that as a subject, ophthalmology must be the same everywhere, be it the entrance exam for UK, or be it, let's say I have worked in Bombay, I have worked in Delhi, I have worked in Vietnam. So, but what I gained from working at so many different places is not just the surgical experience. You get to see so many different kinds of patients. You get to see diverse patient populations, different patient psychologies, different surgical techniques, different ways in which a senior surgeon might approach that patient. So how eye care was practiced in different parts of India and the world, and to bring that knowledge back home, that kind of shaped my, I would say, that kind of pushed me to, go slightly further. Okay, once the MS was done, slightly let's do a DNB, let's do a FICO, because every degree is technically a degree which I eventually was able to gain has given me some knowledge about patient's psychology, right? A cataract is a cataract in India, be it Vietnam, is in the US. But the way you approach it and the way you see so many different doctors from so many different cultures approaching it, and the
Mhm.
kind of insight it gives you into the field of ophthalmology as a doctor, I think it's immense, and this, I would believe, has shaped me into a more adaptive and a more empathetic doctor. Sure, the route was demanding. I had to travel and I had to study for, I would say, for a better part of my early 30s. But the effort that I had given at that time, if you talk to my patients today, you will get to know that the effort clearly shows in the way I talk to them. It kind of is an integral part of my confidence as a surgeon. So yeah, this diverse experiences in regards to the number of patients you treat and in regards to the variety of patient populations that I was exposed to by working in different environments has helped me immensely in shaping my, I would say, journey as an eye specialist, as a doctor.
All right. Yes, and it must have been a rather enriching journey because it's pretty elaborate. Not just in terms of what all you gathered in terms of experience and through your studies, but also the different geographies.
Right.
Looking back, were there any turning points or moments where you knew ophthalmology was the right calling for you?
There were a few, but at the top of my mind, I can think of two very distinct incidents that kind of made me stay, or let's say made me a permanent member of this club of ophthalmologists. One of the incidents was, I think, in the first year of my residency. I was assisting, that I was not performing surgeries. I was still an OT assistant or assistant surgeon to my senior doctor. So there was a patient who had come in the OPD, and we were sitting with our seniors and, just taking notes. And that patient was brought in by somebody. He was not able to walk, not able to see. His vision was, he could just, if you just move your hand in front of his eyes, he could just say, yes, I can see something moving. That's what his vision was, nothing else, right? And his clothes were all torn. He could, if he felt like he has lost up on life altogether, right? And we checked him, and he had both eyes highly advanced cataracts, because of which his vision was completely blocked, right? It's like putting up a black patch in front of your glasses, like everything is just dark. And eventually, we operated him for both of his eyes. And at that time, in the hospital where I was working, and we used to admit patients for a day or two, and the patient next day was discharged. And after 2 3 weeks, he came back to the OPD, and nobody, literally nobody, was able to recognize the patient. He had put on a shirt, he had shaven off his crazy, insane beard that he had at that time. He was wearing glasses, and he came bringing sweets for everybody. And he had, then we came to know that he had lost everything in life, just because he was not made aware by anyone that you require an eye surgery. He just thought that his eyesight is just dying, that God has not been kind to him, and he lost his job, he lost his family, he was living all alone. Just by doing cataract surgeries on both of his eyes, his entire life changed. He started working again. I mean, for a junior resident in first year, this was like, oh my God, like, is that what I can do? Is that what I can bring in someone's life? That was absolutely insane. The second thing, which was, I have particular affection for kids, and we have a lot of kids coming in, and in India especially, and in some other countries as well. There's a condition called squint, which one eye goes one way and the other eye goes the other, and it's considered in some cultures to be a God's gift. This is what God has given you, so this is how it is. Nothing can be done. Even till today, there are many people who believe there is no cure if your kid is born with a slanting or a deviated eye, so to speak, right? So there was a kid 4 months old, and his both eyes were going sideways, and his mother had come to show, and I was there with my pediatric consultant, pediatric ophthalmology consultant, and she was crying, her mother, because her entire family was against her. That no, this is how it is. The kid is too small. Nothing is wrong. You don't need a doctor. But she just came alone by fighting with everyone, right? She was the kid at 4 months of age was diagnosed with bilateral cataracts. Uh, I was surprised. It was the first time I came to know that we can operate cataracts even at the age of 3 months of age for someone. And if we don't do that, their vision for their life can be damaged because the light just does not reach the retina in the eye, the back portion of the eye, and from there it does not reach the brain. So the visual pathway does not develop if we don't clear the path for the light to reach the eye. So we operated that patient for cataract, 4 months old, and at that age we don't implant the lenses. So the patient had to wear a +8, +10 glasses so that the light can reach the retina, and her mom was so courageous to do this against all societal norms, that she was always saying back home, people say, what have you done? +10 glasses, such thick. +10 glasses are very thick. They are literally this thick, you know. But she went through the rigorous journey. I saw the kid turning 2.5 years old. At that time, the glasses changed into contact lenses because now she was slightly older. Then I was lucky to be there till she turned 3.5 years old. At that time, we could implant the lens eventually. And eventually, the patient was able to see well. And now I know that if we would not have intervened when the kid was 4 months old, she would
Mhm.
have been functionally blind her whole life. So we practically, I don't know, we have kind of infused a new life in that child's in that family's world, for that mother. And the face of her mother eventually, when she could see without glasses and everything, it's just priceless. There is nothing which comes even close. These kind of experiences showed me that ophthalmology was not just about only precision and science, but also about restoring dignity, independence, and even joy in people's lives. So, yeah, these two experiences, I would say, are at the top, and they just made me stay with this field forever.
Wow. And really profound stories indeed, Dr. Zit. Yeah. And yeah, it's I can only imagine the fulfillment you get out of that journey and for making that kind of a difference in someone's lives.
Absolutely.
You've you're known for expertise across cataract, refractive surgery, corneal care, glaucoma, and even medical retinal procedures. So how do you balance being multi-speciality while maintaining depth in each area?
That's a very good question. I would not call it being a multi-speciality in that sense. I would just call it like what we call as a comprehensive ophthalmologist, right? That n- that to know a bit about everything. Because it's very important to recognize that the patient does not always come with problems neatly divided into one box. A cataract patient can have glaucoma, a glaucoma patient can have a diabetic eye disease, a patient with a corneal disorder can also have a refractive correction. And the way I approach patients, if you just take a step backwards, right, and you listen to them, these patients have chronic diabetes. Some of them have had a recent history with cancer surgery, and now they are so afraid of hospital visits, and now they are so angry that after the entire stint of cancer, now somebody is diagnosing them with cataracts or glaucoma, and they are so anxious, so vulnerable in that state. So that's how a patient is. A patient is just not an eye disease in that sense. It has its own backstory. The relationship with their parents, we get to hear about everything. The in-laws, the patients. If you let them talk, they tell you so much, not just about their eyes, but about their entire life. Right. So for this, you need to understand the correlation between, let's say, diabetes and eye care and the eyes. You need to know the correlation between a history of cancer and its treatment and how can that affect the eyes. You need to know that if a patient has both cataract and glaucoma, what will you treat first and why? So this is the reason why you need to be able to not just look at the eye, but at the person as a whole. And that has always been my go-to mantra. Let's say, the tagline for my clinic is care, compassion, and then eventually cure. Right. So that's what I believe in. And at the same time, I also understand that depth matters. The technology, as we all know, is changing at the speed of light, So I need to keep myself updated with the latest techniques, the latest updates in medicines and everything. So that's one more reason why, being kind of in a comprehensive state of mind helps you treat the patient as a whole. It helps you offer comprehensive care without compromise. You don't need to send the patient to different doctors for different things. You kind of can be their one-stop solution in more ways than you can imagine. So that's what kind of, I would say, kind of pushed me towards getting to know enough, or let's say more than enough in cataract, glaucoma, retina, because it's all kind of eventually interconnected in this 2.5 centimeter sized organ called your eyes. So yeah, that I would say is the reason.
Is there one that feels most rewarding, where you see the biggest impact on a patient's quality of life?
Yeah, this question, I think most ophthalmologists would answer, the answers would be the same. It's the age old, the classic cataract surgery, right? Especially in a country like India, where there's more than 50 million cataract surgeries that happen every year. And the backlog also is immense. Yes, if you compare it to the US, in the US, I guess somewhere around 6 to 8 million cataract surgeries happen in a year. In India, I think it's more than 50, 60 million surgeries happening every year. And still there are patients and patients and patients still waiting to get diagnosed and operated, right? And it's one of those rare procedures in medicine where the transformation is almost immediate. Like the example I just gave you a few minutes ago, right? A person might walk into the hospital unable to recognize their own kids, and that's their primary complaint, unable to read, losing confidence, losing their independence. There are patients who say, I can't even go to the washroom at night on my own. And when the relatives go outside the clinic, they tell me, sir, I have to call my daughter-in-law or my son at night when I want to use the washroom. I feel extremely ashamed. Please give me enough functional vision to be able to eat on my own and clean myself on my own. Like they tell me this when the relatives are, on the outside. That's the complaint. And within 24 hours, practically, a cataract surgery can open up their world again. So to see this is a privilege that never gets old for me. And but beyond cataracts, even refractive surgery is deeply fulfilling because now the same problem, as I said, there are patients who cannot start their day without their glasses, right? And I had so many patients, like for example, there was one patient who was a friend of mine. She was a pathologist and she always had to work in microscopes throughout the day. And she had a -7 correction. So she was practically handicapped without glasses. And post performing LASIK on her when she got freedom from glasses, her life changed. Her depth of focus changed. Her daily routine of constantly working on microscopes and all with all that high magnification, she was so happy after that surgery. After like she wore glasses for 36 years in her life, and eventually now she can see everything without them. So, sometimes just even guiding the patient in the right direction is all they need. The right advice is all they need. And yeah, so at the top of my list, cataract surgery and LASIK, refractive surgery, that would be the top two.
Now, technology is transforming medicine, at a rapid pace. And with platforms like HealthOK Global aiming to reduce paperwork and streamline patient care, how do you see technology shaping the future of ophthalmology and medicine more broadly?
Yeah, so the tech has been evolving in a way we couldn't have imagined even, I would say, 7, 8 years ago. So right back when I was in my post graduation between 2014 and 2017, everything was on paper. If patient loses his or her file, that was the end of it. There was no way for me or anyone to know what the patient's medical history was, what was he prescribed previously, what has been his or her diabetes for the last 5 years, etc., etc., etc. There was no way to get these records. And what's exciting now is how technology is not only improving my surgical precision as far as the machines are concerned in my field, but also transforming the patient's experience of care, which is, I think, very important, right? So, for example, platforms like HealthOK Global are a great example of this, right? It not only reduces paperwork, it also integrates medical records, right? And it allows the doctors to focus more on what they are supposed to do, be with the patient, right? And for all those who are aware of Indian private non corporate health setups, the doctor is the administrator as well. He has to take care of everything. And this shift through tech is powerful because medicine at its core is about human connection. And the more of it that I can do during my day, the better for the patients, right? So looking ahead, I would say technology makes care even more predictive and personalized. Like, for example, artificial intelligence is coming up, which can help us detect some disorders even before the patient manifests those symptoms. There is teleconsultation now, right, which kind of makes me connect with the patient sitting thousands of miles away from me, right? And I can guide him in the correct direction. There are digital platforms which empower patients to track their own health in a way, right? They can maintain and see how their parameters are performing. So tech will replace kind of a lot of things, not the doctor-patient bond, but apart from that, it kind of acts as an enabler for us in a variety of ways. Machines can process so much of data that I see tech as an enabler in my practice going forward, where it will help me to focus on what I choose, or on what I chose this field for, is to be with the patient, talk to the patient, listen to the patient, and eventually treat the patient as a whole and not just as some individual with a disease. So that's where tech comes in for me.
Yes, indeed. And this is really what HealthOK is working on as well. It's not just technology, it's also ensuring that the human connection strengthens because of tech and not the other way around. So, one thing that stands out from your patient's feedback is how much they value your empathy. Many say you treat them as persons and not just cases. How do you make sure compassion remains at the heart of your care?
So I've always believed that medicine as a field is so much more about listening than it is about treating. When a patient walks into my clinic, as I said before, we don't know what their history has been with their health. They are often very anxious, vulnerable, sometimes even scared. Like, because for me, I might have done 15,000 cataract surgeries, or let's say 5,000 corneal procedures. But for that particular patient, it's the first time someone is telling them to go under the knife, so to speak, right? So before I can help them medically or surgically, I need to connect with them as a person to understand not just what their file is saying, but also what they are feeling. That's why I never consider a patient as a case or a diagnosis. I try to see them as someone's parent, someone's child, someone's loved one, because they are, right? And when I keep this in mind, the compassion just comes naturally. You won't believe how frequently it happens that a patient comes in and I have already counseled him about everything uh, for 15-20 minutes. And at the end of it, he'll say, "My son stays in Australia. Can you just please call him and tell him what you just told?" Right. And so that is the point where the connection aspect of this comes in, because the patient is kind of convinced with me, but yeah, now he wants his son to be validate my credentials, so to speak, that okay, I agree that you can operate on my father or my mother, right? So this happens so frequently. And this is my one-to-one, this is where it happens when I'm just one-on-one with the patient. So I can very easily say that please talk to the counselor, they'll help you out. But if it's me who personally talks, which I try to do maximum number of times as I can, it changes everything for the patient. The patient's confidence on me as a doctor, as a clinician, as a human being, and in my field, I'm kind of almost always younger than the patient I'm operating it, because 70% of my patients are 50, 55 plus. So it's always like I am the young one. And on a practical level, I would say it means slowing down enough to explain things as simply to them as possible, to reassure them of their eye care journey, as in not just a surgical procedure, but what would happen after, right? To make space for their questions, and no matter how small they might seem to me, like for example, questions like, would my eyes pain the next day? Would my eyes itch the next day? Like for me, it might sound something very, very meek, right? But for that patient undergoing that surgery for the first time, it's everything. They want to know each and everything. And I try to be the person to tell them, because I believe in a healthcare setup, you might have a counselor, you might have a lot of people, but the doctor himself, I think, is the best person to deal with these questions, right? So for me, empathy isn't an extra in healthcare. Like, it's the foundation. It's by default. It just has to be there. And the patient is never going to remember me, I believe, about how perfect of a surgeon I was. I think he will always remember me by how I made him or her feel, right? And if that is good, if the patient is happy with me as in an entirety, then I think I have done my job well. That's how I think about my profession.
That now communication is such an important part of trust, and we touched upon that. How do you approach explaining a complex eye treatment in a way that reassures patients?
Yes, so you're absolutely right. Communication, as I just told you, is a foundation of trust, right? In eye care, many of the terms and procedures, no matter how well equipped I am with them for the patient, they might seem intimidating. So my approach is simple, right? If I can't explain it, what I'm trying to tell the patient to a 16-year-old, that means I should be making it simpler for the patient to understand because the mindset and the mental capacity of every patient is different, right? There are some patients, young patients, who are well versed with the English language and they can kind of understand most of the terms you say. But there are a lot of patients coming in from areas and communities where uh, even the disease, they would have a separate name, a local name for the disease in that community. So they don't know what glaucoma is, but they might know what kala motia is, or they might know what kala pani is. So there are areas where glaucoma is called as kala pani, and cataract is called as safed pan, right? So with experience, as I said, by being in multiple cities, if I use these words, they instantly feel the connection with me, right? So I can give an example. I was in Bombay for 4 years for my post graduation, so my Marathi was gradually became quite well.
Mhm.
And now here back in Gujarat, there was this patient, a young guy, who called up his parents from their village, and it's somewhere in Maharashtra, right, in Dharwad. And they both had come and they're like, sir, I want to get them operated here because I stay here. But my mother does not understand Hindi or Gujarati. So I was trying to talk to her and everything. And the moment I started speaking in Marathi, she smiled. She smiled like anything. Whatever was stopping her from getting convinced by to get operated, everything just got 1,000 times smoother. I often use analogies also while I counsel my patients. So, for example, the most common thing that I encounter among the young patients is dry eyes. Dry eyes is kind of an occupational hazard now, right?
Mhm.
Because of excessive screen time. And a variety of studies have shown that more than 4 5 hours of screen time will cause eventually some form of dryness in your eyes. So it's kind of an epidemic. I have patients every day, young IT guys, CA people, who are spending 7 8 hours on their laptops. So how do I make them understand the importance of the condition that they are suffering from? And sometimes it's not just the dry eyes; it's also the muscle overload, the accommodation spasm that their eye muscles go through. So what I usually say is that, for example, sir, if you go to the gym for an hour every day, your muscles will not give up on you. But what if you go to the gym 6 hours a day? Within a few days, your muscles will be done. Something similar is happening to your eye muscles. And the moment I talk it in this fashion, it immediately gets ingrained in their psyche that, okay, yeah, this is what my problem is. And trust me, the better understanding of the disease the patient has, he is that much more likely to be compliant with the treatment. Many a times you prescribe medications, you prescribe drugs, but we all know people who we have prescribed them meds for 5 days and they will stop in 2 days. We have given them drugs for a month, they will stop in 7 days. Okay, I feel fine because their understanding of the problem is not complete. So the better understanding the patient has of the problem, the more chances are that they'll be compliant with your treatment. And that's the approach I take. That's how simple I try and make the condition of the patients in front of them, right? So patients and plus patients always need to feel that they can ask questions, sometimes the same one 3 times, and that is okay, right? You will be surprised. Many patients have this doubt that how many drops of the from the bottle I need to put every time, right? The answer is just one drop every time. But then they feel if I put 2 or 3 drops, shouldn't it work faster? Like, will it work? They are very simple questions. It might irritate you that, boss, it's not possible. Your eyes does not have space to hold the 2 drops at the same time. But that's what I know. That's not what he knows, right? So for him, that question makes sense. But I need to make space for that to happen in front of me in the OPD, even though it requires a few more seconds of my time. But yes, that's so far in my profession, in my career, that's approaches always work for me. So yeah, that's how I see it.
So, Dr. Sujit, we spoke about communication and how important that is. Follow up care is another area that matters deeply. So, how do you ensure that patients feel supported even after the surgery?
So it again forms, it's again is a part of my care, compassion, cure motto, right? That the patient For me, surgery isn't the end of treatment. It's the beginning of the patient's journey of healing. That's how I see it, right? In follow-up is where either the long-term trust is strengthened or it is lost. And I make a point to stay connected with the patient. That means, of course, giving clear instructions and always being accessible. But I also tell my patients, if you are worried, you can call me, and no question is too small. At least for the first 3 days after I operate on patients, I try my best to personally cater to any calls that they have. Even if it is for like, sir, I'm getting some itching in my eye, which is normal after surgery, but still, even for such small questions, I try to be there for the first 3 days. This reassurance alone, most patients don't even call. Most patients don't even call. But if they know that yes, the doctor's personal number is there with me and he will be there no matter what, that changes everything. That reassurance alone gives them a sense of security. And I try to personalize follow-up care in that sense, that you matter to me, sir, ma'am, whoever the patient is, you matter to me, and I really want to be a part of your healing journey as well, right? And I always try to make sure they know that their journey beyond the operation matters to me equally as much as the surgery did. Because a lot of patients have this complaint that post surgery, it's kind of impossible to connect with the doctor again. The doctor might have his or her own reasons for this, but at least so far, I have been successful in being able to stay in touch with the patients for the first few days post surgery. And I think, touchwood, all of my patients have always come back in happy, smiling, and they always feel comfortable in talking, whatever they want to ask to me. There are many cases where the grandparents in their family, the seniors initially came in with their kids or their in-laws, and eventually they came in alone because okay, I can handle it. I can ask him anything. It's fine. It's all good, right? So that's how my experience with this has been. And yes, I take follow-up care very, very seriously.
Looking forward, Dr. Suchit, what excites you most? Whether it's new treatments, technologies, or research areas that you're involved in?
What excites me the most is that ophthalmology is a field where tomorrow often looks dramatically different than today. We are moving towards treatments that are not just corrective, but also preventive and now even degenerative. So, for example, in cataract and refractive surgery, there's constant development happening in the field of intraocular lenses, where you are practically now able to make the patient free from glasses completely in their 60s. Like there are patients who have been wearing glasses for 50 years of their lives. And now for the next 20, 30, possibly, hopefully 50 more, they are able to see the world without glasses. This is insane. It is absolutely insane. And we as doctors couldn't have imagined this 10, 12 years ago, right? For example, in the field of retina, imaging has reached such a stage where we can detect diseases like diabetic retinopathy, glaucoma, macular degeneration at a very, very, very early stage, right? And this is the stage where you can almost treat most patients medically, and surgical intervention is not required. And if you can diagnose them at this stage, they might ever not even require a surgery. So that's where it's going, which is very interesting. And also, the research is happening in the field of stem cells and gene therapy, where previously the diseases which we call as genetic disorders, right? That's how your genes were. We are so sorry, we can't do anything about it. This is how it's going to be. Now, through the gene therapy, we can kind of even modulate this, right? So there are some
Wha-
promising studies which have come up. For example, there is a disease called retinitis pigmentosa, where because of some reason the patient's night vision is lost, right? And it was always considered to be untreatable. But now, through stem cell therapy, certain injections are coming up. It's a very long way away, but yes, it's coming up. And the early studies in animals have shown promising results that yes, the injections of these stem cells kind of change the patient's, I would say, DNA of sorts in that area of the retina, so that this disease can completely be cured, right? So yes, these are the fields which kind of excite me as a surgeon, as a consultant. On a personal level, what excites me even more, I would say, is the thought of accessibility, right? Especially in a country like India where healthcare is not the same everywhere. We all know this, right? And how can we make sure that these advances that I just talked about reach the people who need them the most, right? Not just in the big cities, but in smaller towns. A lot of companies are coming up, especially even through teleconsultation, which are on the rise since last 5, 6 years. As I said before, we are able to connect with patients thousands and thousands of kilometers away from us, right? Who never could even dream of talking to a specialist in that sense. We can do that now through AI. We have certain centers where in a village, they take images of the patient's retina and they transfer those images to the doctors in the cities. The doctor sitting there can tell, okay, whether it is medically treatable or you need to refer them to me or to anyone for surgery, right? So that is where it's going. The accessibility is improving, and that kind of excites me, I would say, the most among all the other things I just mentioned, because technology is amazing, but its impact depends on how well I will be able to deliver it to the people who need it the most, right? So that's the area of accessibility is improving the fastest, and I'm very happy about it.
If you could share one piece of advice with young medical students or aspiring ophthalmologists, what would that be?
My advice for them would be, as someone who has been in opthal now for over 12 years, is that never lose sight of why you chose medicine in the first place. Because the journey is rough. It's easy to get caught up in exams, in degrees, in competition, and even later in your career, once you have a wife, kids, you can get stuck with numbers. You can get stuck with a lot of other things, right? But at the heart of it, always remember medicine, any branch it might be, it's always about the people. If you remember that every patient is trusting you with something very precious to them, it's their health, it's their life, it's their hope. If you remember this, you will always find purpose in your work. Apart from everything else, the one thing which separates the field of medicine, be it ophthalmology, any other field from every other field, right, the is the point of purpose, right? The purpose and meaning that this field gives us, the satisfaction that uh, being a doctor gives you on most days, I would say, right? When you see in my field, when I see people 60 years old, 70 years old, kind of fall into my feet or even trying to touch my feet sometimes, because they're so happy after surgery. Because that's how in India we show our reverence, right? We show our respect. We join hands, we bow down or something like that. And somebody who comes from very humble backgrounds, they do this in the OPD, and it just there is no comparison for this. There is no comparative analogy I can give for this experience, right? So no matter how hard the journey gets, keep this mindset, and this mindset will turn your pressure into purpose, right? And always be the kind of doctor who treats not just patients' eyes, but their lives. And your work will never feel like just a job. Because in the end, in my opinion, the greatest duty as doctors, especially ophthalmologists, is not just to restore vision, it is to restore hope in their patient's life. So that's how I see it. And if this purpose can be kept in mind forever, then I think you'll be just fine.
Fantastic, Dr. Suchit Dadia. Thank you so much for joining us today on Doctor Dialogues. Your journey from medical school in Ahmedabad to international fellowships to your diverse expertise in eye care shows how dedication and empathy can go hand in hand. And of course, something that I take away is your motto: care, compassion, and cure. So, thank you so much for spending time with us and sharing your insights. To our listeners, if you'd like to learn more about Dr. Sujit Dadia's work, you can find him at Insight Care Hospital at Ahmedabad and through HealthOK Global, the doctor focused platform that helps physicians focus on care. We'll be back with one more inspiring story in another episode from Healthcare Leaders. Until then, stay well and let's keep the dialogue alive. Thank you.
Thank you so much for having me, Kaustubh. Thank you. It was a pleasure.
Thank you. Thank you, Dr.